What testing is usually done at 100 days post-transplant?
What testing is done and why is it done at day 100 after an autologous stem cell transplant? First of all, at around 3 months out from transplant, we restage the patients or reassess their disease response with a bone marrow biopsy, 24-hour urine, blood work including light chains and electrophoresis, to really get a sense of if they're in a complete remission or if they are in a partial remission. The reason we wait until 3 months is that the monoclonal protein in their blood is a large molecule. It takes sometimes quite a while to filter out of their system and degenerate, and so it can take a few months sometimes. And so it really takes that 3 months before we see the full response. If we just look at 1 month, their monoclonal protein may still be hanging around, and it's going to continue to come down over the next 2 months. And so then we'll restage them with marrow, urine, blood, and then it depends on what they had baseline for imaging. Consider repeating imaging as well at that point.
What kind of blood tests are done?
So we do serum-free light chains, protein electrophoresis, immunoglobulin levels, as well as blood counts and chemistry panel. And these days, we often typically include next-generation sequencing on their bone marrow to look for MRD negativity, as well as just the standard bone marrow pathology and flow cytometry.
What other tests are part of the day 100 workup?
We still do a 24-hour urine collection, really to get the International Myeloma Working Group response data or assessment. We have to have that 24-hour urine to immunofixation on that 24-hour urine to know for sure if that patient's in a complete remission or not. So even though the serum light chains to some extent may replace routine urine testing, at least periodically we have to do that 24-hour urine electrophoresis with immunofixation to confirm that there's no trace of monoclonal protein in their urine.
To learn more about the tests that Dr. Anderson just mentioned, watch the lessons that are found in HealthTree University's Monitoring Response to Treatment module. These lessons describe each of the assessments mentioned in detail. And remember, you can keep track of all your test results by joining HealthTree Cure Hub. It's easy to connect your medical records. Once your medical records are connected to HealthTree Cure Hub, your labs will automatically be uploaded. You will be able to view all your tracked lab on the Cure Hub website.